global health matters. It matters because it embraces people's health and well-being, cutting across the geographical, cultural, and socioeconomic borders. And in the times we live in, we are witnessing significant global health concerns, whether it's about the infectious disease, the COVID pandemic, previously the Ebola crisis, so on and so forth, and the recent war right now in Ukraine, which really makes us to think about what is our role in humanitarian settings. And that's the reason whether we need to prioritize coordinated efforts to solve many of these challenges that we see in global health at this moment. And there are several complex layers and challenges which are at play in global health. And we need to think about collaborative action, whether it ranges from the infectious disease to non-communicable diseases, to mental health, to environmental health, and of course the access to the healthcare to reduce the health inequalities that we witness around the world. It's quite poignant that we also think about that achieving what we want to achieve in global health is consistent with the United Nations Sustainable Development Goal of good health and well-being for everyone, not just one, but for everyone. And it is critical to remember that global health is about more than simply individual health, and it includes many other social, economic, and environmental determinants of health. So basically, no matter where you live, where someone lives, how much money you make, what's your gender, or where do you originate, we need to fight for the laws and initiatives that promote health and well-being for everybody, not just for one person, but for everyone. And this involves providing access to high-quality care, encouraging preventative health measures, and addressing some of the existing inequities in health. And of course, that requires investment in health education and awareness. We also need to foster stronger partnerships and collaboration across various stakeholders, including governments, international organizations, non-profit organizations, local communities, and so on and so forth for global health. And we can achieve so much for the communities that we serve by joining forces and cooperating together. So let's be the change agents, the advocates, and the ambassadors for global health in your capacity. And by making these small and large differences that you are making in improving the health and well-being of people around the world, we can really create healthier and sustainable communities for current and the future generations.